Hello, everyone, and welcome to the Society Scoop, where society's biggest conversations come to life. I'm your host for today, and I'm Christabel Enim. So, you're going to dive in one of the most talked about health trends on social media now, which is the Hunter virus. Is it another global threat or just a social media panic? Let's dive into it. Let's scoop the reality. So, I'm here with my guests.
Cindy Ohini Asiedu.
Amankwa Emanuela.
And I'm Derek John.
And together, we are going to give you more scoops on the trending social media issues. So, somebody will ask, so what's our focus? So, in the society scoop, our main focus, we have a lot of, but our main one is talking about public health conversations and also trending social media issues and also youth awareness and education. That's our main focuses. So we break down complex topics into simple, relatable, and engaging conversations for listeners. And we specialize in explaining trending topics in simple language, encouraging critical thinking and public awareness, also creating engaging discussions around news, culture, and society. So, why is our podcast important? The reason why I want you all to follow, like, and share our podcast is because it creates awareness about hygiene, disease prevention, and public health. And also, it allows society to discuss how social media influences fear during outbreaks. And many people are spreading misinformation, and panic about it. So now let's dive into the main topic of today, which is the Hunter virus. What is Hunter virus?
Okay. So hantavirus, when they talk about hantavirus, it's a very rare but dangerous disease.
Okay.
A virus that's spread mainly by rodents. That's rats and mice. And how can humans get infected?
Yeah.
So humans can get infected through breathing in the contaminated air from the rats' urine, their saliva, or their droppings. Yes. And when we breathing, I've already talked about the breathing in air of the rodents. And when we touch surface that's infected and use it to touch our face again, you can get infected through that too. Yes. So that's what hantavirus is.
So actually, Hunter virus is you getting from droppings of some rodents, unlike COVID-19, which is from person to person. So you guys should take note of that.
Yes.
So it's actually trending on social media. It's really trending.
Mm.
So why is it trending? Why is hantavirus trending?
So with the Hunter virus, it's trending because there are death report cases in other countries.
Okay.
And also people are comparing it to COVID-19. So with this, it's something like a new pandemic. So it's something that's trending because there is a case on it about death. Yes.
And I think it's trending also because they recorded cases from the cruise ship. They recorded, I think, 3 people. That's a husband and a wife and one woman, I think. Yeah. So because of that, I think from the videos that we were seeing, people were like, they should just sink the cruise ship, so that they won't move from shore to come and infect
others.
It's infected. So that's it.
But I feel like some people are really exaggerating on this trending issue because of that it's causing fear and panic.
Oh, really?
Some, they don't have idea about what's going on, but they just want to, I think, they just want to get an attention from the public.
Yes.
So they are exaggerating on the issue, which I think they should stop because it's causing fear and panic.
Yeah. And
so before that, okay.
And the hantavirus too is something that's there. Yeah, from what I learned, is there. Just that is becoming more trendy because of what I talked about earlier, the recorded cases from the cruise ship or the ship. So it's something that there's no a new virus or anything. It's there for the rodents or for the animals. It's the virus that's in them. It's a virus that's
but
in
they
them.
just recorded the case.
Yes.
I also think from the sudden death that caused on the ship, there's also that's why it's trending because it looks like to people it's new.
Yeah.
So just a new virus causing deaths.
Okay.
It's something else. Yeah.
So the important facts about hantavirus. What must we know about hantavirus? What are the important facts?
I feel the audience are supposed to know that there's a difference between hantavirus and coronavirus. With the hantavirus, one cannot get infected when it comes into human, like when it gets in contact with another person. One can only get infected when it comes in contact with rodents. With this, it's less likely for it to go global, like for there to be a pandemic.
Okay. What are the symptoms? Is it like COVID-19 or hantavirus has its own symptoms? So they just want to know what are the symptoms of hantavirus?
Okay, so it's not the same as COVID-19.
Okay.
The symptoms, some of the early symptoms are fever and fatigue and what is it? Dizziness, yes. And some of the severe symptoms too are coughing, low blood pressure. Yeah, that's it.
I think difficulty in breathing too.
Yeah,
Yeah.
yeah.
So hantavirus and COVID-19 has some similarities in terms of their symptoms.
Yes.
But they are not all the same.
Yeah.
Hantavirus is droppings from rodents and COVID-19 is person to person. So you guys should take note of that. So what are the types of hantavirus?
So with the types of hantavirus, we have the HPS virus.
Okay.
That's the hantavirus pulmonary syndrome. And we have the HFRS. That's the hemorrhagic fever with renal syndrome. So with that one, let me talk about the HPS. It affects the lungs and it's mostly in America.
Mhm.
And with the HFRS, it's mostly in Europe and Asia and
Okay.
affects, I think, the kidney. Yeah.
Okay. And a lot of people are saying it's very dangerous. Very, very, very. You, even if you have kidney failure, you just imagine how it is. So, because as our sister said, it attacks the lungs and also attacks the kidney. So a lot of people think that this disease is very dangerous. So how dangerous is it?
Yeah, with the hantavirus, it's very dangerous, as you said, because with the HPS, it affects the lungs. So even with prices of dialysis, it's
Yeah.
not easy.
Very,
So
very
if
expensive.
something is to attack your lungs or kidney, just imagine how it is.
Yes.
And it has caused almost 30 to 40% of people and they died. So if you see this similar symptoms as my co-panelists said and you think you don't feel too well, just seek for medical attention.
Yeah.
That will be the necessary step to take.
Okay, that's very, very nice.
Yeah, and don't get it wrong too. Just because someone is coughing doesn't mean the person is with hantavirus. Yeah,
Exactly.
So you have to get the difference.
Yeah.
The difference is really important. And the danger of it too when it comes to Ghana. Because Ghanaians, I know, it's not like I don't know. Some of us eat rats.
That one day.
Some of us eat rats. So with you eating rats and rats having this virus, it's very deadly. It's really, really deadly. Yeah, so I think even the causes of it, I think they don't even know Ghanaians eat rats. That's why they've not added when you eat rats, you have to get infected. But for me, that I know that Ghanaians eat rats.
But I
Eating
feel
rats-
like it's not mainly per se you eating rats getting it. It's you
Yeah.
getting contact with their
yeah, by
droppings.
eating it, you are getting contact with war.
I get it, but their feces and the rat itself is two different things. The feces
Okay.
are the decompose that comes out of the
Okay.
animal. So I
can say
think though
that.
we can eat it, we should make sure we get them from the right sources. Even if they're from the bushes, you should make sure they are hygienic.
No, we should just stop eating rats.
And
That's
It
it.
can't be
how are they
possible.
still if-
The thing is, yeah, because it's a virus that's in them. So definitely.
But me, my problem is the rural areas. Because come on, the slums and everything, because of choke gutters, there are a lot of rats there.
Yeah.
A lot.
Yes.
So I think the assemblyman or the minister of health, they have to do some general. They shouldn't wait for the virus
To
or the
hit.
disease to hit Ghana, Africa, before you take it serious. And that's one thing about blacks. We wait for last minutes before
Just
we
now,
take action.
now they'll be like, oh, we won't reach here. Like,
Yeah, that's the same thing
But
with
no, we can't predict that. Yes.
Yeah, so we have to be very, very careful.
yes.
So how can we protect ourselves? Since you've given them more of how it causes, the types, how can we protect ourselves?
Okay.
I mean, these are some basic things every individual should know.
Okay.
Like cleaning your house, blocking holes that rats can pass through. I
Yes.
mean, there are some basic things you should know.
Yeah.
Yeah, using disinfectants and also storing food properly.
Yeah. And not taking a killed rat with your hands like a mouse. I know when we were kids, some will go and just pick up a rat and will be using it to scare her friend or her brother just because his brother is scared of it. So please, you shouldn't do that. You should just take what is it called? the already sign run, then you use it to pick it up, then you just go into all.
That's escalator.
It's even better than
Yes.
Why should you even take the killed rats? Just
Yeah.
leave it.
But we were
But
up to
since
before.
now we know that hantavirus is from them, I'm not
Yes,
sure.
absolutely.
Yeah,
People will take
and
and do their hand.
if I'm to add some, I'll just say we should make sure the surroundings are mostly neat because
That's the thing.
we using utensils and other stuffs and just leaving them there.
Yeah,
It
that
brings
one.
and attracts those stuffs.
Yes.
Yeah,
So if we
very
have
true.
something doing when it comes to dishes and those things, let's just get the work done.
Yes,
and
after
clean it.
eating, you just wash the plates.
Yes.
Don't leave it out. Yes.
So with these, it wouldn't attract rats and those
yeah,
things.
yeah, that's really true.
Oh, okay, so I have some few questions, and our viewers want to know the answers. They are asking and they want to know. So one, they are asking, why do people panic quickly about new disease? Why do they panic quickly about new disease? Why?
Okay, so I would say people panic about new disease because they are scared of the unknown. You get fear of the unknown. So you have to just relax. And I don't know, I won't say prepare ourselves. You just have to relax because a pandemic, we have already experienced that before. So we will always have fear of it. And even if we haven't have experienced it before, something that will come that is deadly to the environment or to humans, I know is going to really scare us. So yeah.
And also, I'll say social media contributes with fear.
Yes.
Sometimes
true.
when something
Yes.
comes up and we know nothing about it, people just rant and say whatever they think would be good to hear. So I think sometimes fear comes out through what people say on the media. Yes, please.
But then they are saying the symptoms are similar to coronavirus. So I think they must fear.
Yeah, that's true. That's true.
And it's more deadly.
Yeah, more
Yeah.
deadly than COVID-19.
Even though it's rare, it's deadly too and dangerous.
So second, that's the second question. Should social media regulate health misinformation?
I think yes. Social media should, because getting false or fake news about something like
Information.
something like hantavirus or any dangerous virus is not a joke at all. So it's either the health services or internet, the media take out the fake news and give us more highlights on the real
Just for
info.
public
Yes.
attention.
So no, we are not supposed to bring out fake news, or even if it was to be brought out, we shouldn't let it just go around.
As always, are you saying there's no hantavirus?
Oh, there's
antivirus.
but some people are just giving out
Misinformation.
misinformation.
But I feel maybe they can be right because he just has to take the necessary measures. That's what they are trying to do. That's what I think.
So the best thing is social media should remove the fake news and bring accurate news. So if it's
And that's impossible.
Yeah, that's
social
not,
media.
That's not possible.
That's
Okay,
impossible.
and people even like bad news better than good news.
Yeah.
So
Very.
you will take the bad ones and leave out the good ones because
just so everybody will be safe.
Yeah.
Yes, on the safer side.
Okay. So are we more prepared for the outbreaks after COVID-19? As for me, I'll say yes.
okay.
I'm very prepared because COVID-19 showed us shaggy. Come
Yeah.
on.
So you think there will be an outbreak?
I don't know, but we all were here. We're like, COVID wouldn't come to Ghana.
No.
COVID wouldn't come to Africa.
with the definitions and the explanation, I don't think we can get a lockdown or another this one.
Oh, I disagree.
What if
I
it comes?
disagree
Are we
with that.
prepared? That's
No.
the question.
I would say yes because we've experienced COVID-19 and we were taught, and I think they taught us of how
A
to
lot.
maintain and be in a good hygiene. So I think even if it comes, we've experienced something similar. So we
Okay.
just know how to go
But
about
with
it.
COVID-19, have you seen? It was from person to person. So
Yes.
you can quarantine somebody.
Yes.
But with the rats, how are you going to go about it?
As I said earlier, this disease can only spread through rodents. So if you are wise enough and don't want to get this, it's very easy. You just don't get close to the rodent, and that's all.
And
Yes.
also clean your surroundings.
Yes,
Very
that's
well.
That's very necessary.
But what of our mothers in the market? Because the marketplace, there is always rats and mice.
You know, I feel like this thing,
That's what I'm saying. It's going to be difficult when
It's
it
going to
gets
be
to
very
Africa.
to be honest.
Because me growing up, my mom's store, like you will be killing rats and mice every time. And they are not small ones, they are big, like big ones.
that's
So-
something that the Minister of Health or every community has an assemblyman or something, they should do something that is general cleaning, communal labor. They shouldn't just wait. In mind is they shouldn't just wait for the thing to
Yes.
come.
Yes, that's
Before, hey, we are going to do communal labor today. If you don't do, we are going to arrest you. We are going to do this. No. The thing shouldn't just come before they take an action. They should do something about it. Maybe, should it be every week or every 2 weeks? You have to clean our gutters or something. But it's like nowadays, you barely see those stuff. So
yes.
nowadays, you barely see those stuff. So I think that's all for the questions. And so I'm just going to glance through. So we spoke about hantavirus, why it's trending, important facts about it, symptoms of hantavirus, types of hantavirus, how dangerous it is, how can people protect themselves. Interesting podcast questions were also there. So my viewers, hantavirus is serious, but awareness is more powerful than
Yes.
panic.
Yes.
Understanding the fact helps society respond with caution instead of fear. So you guys, please take this serious. And mind you, hantavirus is not yet in Ghana. So don't be scared. Let's just hope it wouldn't come. That's the thing.
Yes.
Let's just hope it wouldn't come.
And I'll add something little.
Yeah.
Yes, they just need some small precautions and being alert. Just don't get contact with the rodents. Don't get contact with their feces or their droplets. Just make sure the surroundings are neat, because on a normal basis, you use utensils and when you are done, don't be like, oh, I'm tired, I'm bored, let me just wait for some time before I clean up. No.
Yes.
All these things attract insects, rodents, those mounds, and it causes all these things. So if you do something that's using utensils or something and you feel like you want to leave it down, please change your mindset and just get the dishes done. When you clean everything up, you are free from all these little diseases and attracting those rodents. So that's what I'll add. So please, let's just
So what
keep our
if
surroundings
maybe
neat.
my next neighbor doesn't keep her surroundings clean?
You'll go and beat it.
And she's attracting
Because
the
it's getting
rats.
serious.
Definitely, they'll come to my side. That's rats.
I feel
Yeah.
like sometimes you need to talk to somebody for the person to be aware. So yes, when you talk to the person about whatever that's happening and highlighting the person on whatever he or she has to do to be on the safer side, I'm sure the person will be so good enough to listen to you and obey. And
Yeah, but some people are very difficult.
Some Ghanaians are
Yes.
very ignorant and they are nonchalant. They don't
Yes.
care. That's what they said about COVID-19. Oh, COVID, COVID.
Yeah.
But at the end, COVID came.
Oh, but then I feel with the experience with COVID, the wise now.
Yes.
But then
Are you
the
sure?
problem is those in the rural areas. That's the main problem right now. But then with the urban
Those
areas,
people,
Yes.
they can do something.
yeah,
about it.
very difficult.
with the rural areas, they have limited infrastructures. There's the hospitals. They don't really have those things. So if this virus is to go there and there is no enough hospital, it's going to be crazy. So please, the government should make sure there is necessary hospital facilities around so that just in case there is something coming up, we know we have good places to hide ourselves.
Yes.
I just don't know why every community has a leader. But at the end, some rural areas, as she said, they lack some facilities. Why? That's why we elected them to be a leader. But still at the end, so I feel like that's Ghana.
Yes,
that's Ghana
that's
for
Ghana,
you. No
that's all.
matter
It's
what.
Africa, to be
Yeah.
honest.
That's Africa.
Yes.
Because the whites, oh, I'm not sure they'll do this. I'm not sure they'll do this at all. So I think blacks, we act ignorant sometimes and we are nonchalant sometimes. We don't care about anything. So I think we should just take note of that.
Yes.
And I'm saying it again. It's not yet in Africa. It's not yet. We should just hope it wouldn't come. Because I don't want to go for another quarantine. Do you want to?
Oh,
No way, no,
Hell
that one,
no.
You
I
suffered,
can't remember.
Hell no.
From Ebola to COVID-19, and now when I'm in the university too,
No, we don't
Another-
want to.
no,
enjoy our
no,
lives.
no,
We
no.
want to enjoy our lives. As for me, I want to enjoy my life. So like stay at home. Then you send military people, they'll come and beat us if they see you outside. But quarantine,
No.
I didn't enjoy crowd.
No.
Even though the foods were many in the house, you can eat everything you want. But sometimes you feel like
definitely
going
get
out.
bored.
Yeah, you get bored.
Yeah.
The boredness was a must because no, staying at one place all the time, no.
So hantavirus is serious. That's the thing. But awareness is more powerful. You being aware that there is something there, even though it's not yet here, but you are aware of it, it really helps very, very, very well. And understanding the facts helps society respond with caution instead of fear. So this is the scoop, the society scoop, where we bring you the society's greatest conversations in life. We've scooped into the reality, and I hope you enjoyed everything. Keep your comments coming, and we appreciate your time and everything. Thank you, viewers. Bye.
Bye.